findings showing that in the last 2 weeks of July, we have over 97,000 new child coronavirus cases in the US alone. And the rates seem to be growing almost exponentially at this point. This is a 40% increase from the total that we had previously reported, not even in comparison to the previous time period observed. And obviously a greater discussion of how exactly we're implementing reopening our society at a time where we're now in mid-August and schools are reopening and youth sports are returning and people are looking for a sense of normalcy, and there's obviously some expressed concern for children. So, Dr. Rathore, if we can get right into it and talk about this matter, how exactly do you feel about these newly observed rates?
Well, they're very concerning, no doubt about that. And unfortunately, for some of us in some of the states where the numbers are really high, like I'm in Florida, not surprising either. We were sort of expecting this, and I think this is it's a problem because we have loosened the other activities that allowed us to flatten the curve, if you will. And so this increase in number of cases is everywhere, but especially now you're seeing a lot more in children. And that's obviously going to cause additional challenges with children. I think the issue of the number of cases in children goes right along with the issue of number of cases overall.
Sure. It certainly reflects the increases that we've seen. Obviously, there's a greater debate about whether this is the first wave continued or second wave, obviously, with cases spiking, particularly in your neck of the woods and out into the Midwest and to the West even. So California continuing to have issues as well. I guess it does lead to the discussion, though, of course, of, our understood implication for children. Obviously there's observed multi-inflammatory syndrome and some other effects and burdens that we see. But in the immediacy, doctor, what are we seeing in children that's, driving particular concern for them?
Well, I think this is multiple things. One, the number of infections are increasing, obviously. I think part of it is contributed by increased testing, no doubt about that. And as we have opened up the community for activities and gatherings are happening, people are going out, more children are getting infected. I think there's this misconception that children cannot get the infection. I think that's a dangerous misconception. This is an equal opportunity virus. If it finds a susceptible host, it's going to infect. So I think if a child is susceptible, it's going to infect the child. There's no question about that. So I think it's extremely important for us to understand that part of it, where we are saying that, children cannot get infected. Now, I think where the confusion arises, fortunately, most children who get the infection don't get critically ill. They may be asymptomatic, and those are not the ones we are probably picking up, or they may be mildly or moderately sick. So I think that's a good thing. But don't forget, children do get sick. Children have even died with coronavirus infection. So children can get sick. A recent study, I think, of the hospitalized children, 1/3 were in the intensive care unit. But I think the other part of it is you alluded to is the MIS-C. We saw cases of MIS-C back, April or so, and then they seem to have stopped in Florida and talking about now. And now we are seeing a second wave of that because of the increase in number of infections that occurred in May, June, and July. Now we are seeing the result of that. We are seeing more cases of MIS-C, and these kids are critically ill often, and so I think we have to be very concerned about that. So I think let's make one thing clear: kids can get the infection. All right. And the second thing is kids can get seriously ill with the acute infection. They can even die of the acute infection. But more importantly, kids can get this later, 4 to 6 weeks later, post-infectious syndrome that can be very serious, critical, and even fatal.